Hi everyone, let's talk about soft multifocal contact lenses. Soft multifocal lenses can be used for patients who require both distance prescription and reading prescription. As you get older, that happens to most patients of ours that usually have 2 eyes for distance and no longer can use that prescription for reading. So sometimes they can just put readers over the top, but other times they don't want to, and that's when we can try some multifocal contact lenses. So the multifocal contact lenses have your distance and reading all in one contact lens. You get a right and a left, both multifocals. And what that does is it gives you the distance and the reading. Now, there is a limit to it. It's not perfect because the lens design has rings of distance and rings of reading. So instead of having the full lens for distance or the full lens for reading, you've got both prescriptions in one lens. So the vision you get from this lens is very dependent on how well your brain can adjust, because the brain has to ignore the reading part of the lens when you're looking through the distance part of the lens and vice versa. So there is a component of adaptation, but if you can adapt to it, it's absolutely fantastic because you get both distance and reading for both eyes. There is another option called monovision for soft contact lenses, and it's quite different because it uses one eye for distance and one eye for reading. So instead of having both, you're splitting it up. As the name suggests, mono means one. So monovision, usually your dominant eye is for distance, doing all the work for distance. You get the full lens for distance, and then your non-dominant eye is fully for reading. Again, that's just dependent on how well your brain can adapt. Some people do really well with monovision and some people do really well with multifocals. It's something you have to come in and try, and we would work with you to find the correct prescription for you. At the end of the day, I will put out there that both situations, no matter if it's monovision or multifocals, it's not as good as having both eyes for distance, because having both eyes for distance means full prescription, both eyes for distance. You get a lot better vision than having one eye for distance, or multifocals, which is distance and reading. So just do have to keep that in mind, but it is possible, and we are doing it for lots of our patients. So come on in, we can try some multifocals on you, and we can try some monovision and see what works best.